You know, it has been a long and trying year and a half for all of us, but especially for people who we trust with our health.
That's right. Doctors in our emergency rooms and ICUs, they save lives every day. And WLWT News 5 investigative reporter Jatera McGee joins us today. And Jatera, you really got to sit down with some of these medical professionals to get a real look at what it's like right now in our hospitals.
And it was a really impactful conversation, guys. An infectious disease specialist at Christ Hospital, the director of the cardiovascular ICU at UC Medical Center, a nurse manager in the emergency department at Good Samaritan, and the medical director of pulmonary and critical care at Mercy Health. They all sat down with me for a conversation about the last year and a half, but also the years ahead.
The care that these patients require is tremendous. I work in the ICU and take care of critically ill patients who are also requiring ECMO, which is that temporary life support for the failing heart and lungs. All of the ones that we have on ECMO right now are COVID-19 patients, and their ages are 24 to 52.
Bill, you're there from the very beginning, from the time they come into the emergency room. Walk me through what that's looked like lately.
Okay, so what we're seeing is definitely an uptick in our volumes. You know, anywhere from 40 to 50 plus a day more than we were seeing at the start of last year. And it varies day to day. And so like today we're seeing a huge volume increase when we've got 27 patients in our IC or our ED that are waiting for inpatient beds.
See a lot of them gradually get worse and worse to the point that they end up going into the ICU. And on the ICU side of things, you know, I'm having conversations with them about where things are in terms of how likely they are to do well or not. One of the things I consider the most important part of my job, other than trying to support them and try to help them through it, is making sure that if we have the time, that they can call a loved one before they go on a ventilator, because more likely than not, it's going to be the last time they get to talk to them. And that part's really hard.
The most difficult part is hearing day in and day out that we'll have 99% of the patients that are up in the ICU and on ventilators that are unvaccinated. And I agree that I think there's a lot of misinformation out there, not only just in the community, but amongst healthcare workers, and just the fear of the unknown.
So this is something I struggled with. I don't know what you guys experienced, but when we've had this most recent surge, which is from Delta, it's like a lot of this could have been prevented. And so it's frustrating that people haven't gotten vaccinated. It doesn't give you an invisible force field that keeps you from getting COVID, but it makes the odds a lot more likely that you're going to survive or maybe not go into the hospital.
When you're caring for these patients, you know, we see them from when they present to the hospital through the ICU and hopefully thereafter. There's no sense of control or mastery with these patients. It's unpredictable, and it's not a great feeling. With COVID-19, it is unpredictable. Patients come in and they want to know how they're going to do. And I'm like, well, you know, my classic line is, let's just take it one day at a time.
The hardest part for me is recognizing that I'm unable to meet the needs of our community, to give them a therapy that I believe does make a difference in their outcome, but I don't have the resources to be able to do it. It's heartbreaking, actually, to take them off the list, to take a 23-year-old off. And it really happened, a 23 off the list because they died at another hospital waiting to get that resource. Couple that with the morale of the team, walking each day to try to build my team up, because they're suffering as well. The provider fatigue is real.
I'm going to ask you a simple but perhaps loaded question. How are you?
How am I? I have very excellent coping skills. I spend my day, I do meditation, I ride a spin bike, all of which are healthy coping mechanisms and has allowed me to get through this. Do I go home some days and maybe cry in the car on my way home? Certainly, if it's been a hard day.
Last year, every day the press conferences, the meetings at work, I told my boss, I said, I'm getting really depressed. I said, I'm tired of hearing about COVID. I'm tired of hearing about the gloom and doom. I was like, I'm a very positive, upbeat person. I said, this is beating my soul down. When we're away from patients, we have to take care of our mental health as well.
What is it that you all wish that you could show the public, that they could see through your eyes for one day?
I would love for them to see the family members who sit outside the room sobbing, where they can't get into the room to see their loved one who's dying. I would love for them to see right when they're so air hungry and the next step is putting them on the ventilator. The words that I say to them as I have them go off to sleep, and I know that they may never wake again. And if family members and the public would be able to just see the panic and regret in those patients' eyes at that moment, I think it would have an impact on the community that has the doubts, the lack of trust, and the misinformation would be irrelevant.
Some of that's tough to hear, right? We talked at length about the future of healthcare of our local hospitals and the impact the pandemic will have for years or even generations to come. And we'll have more from that part of our conversation only here on WLWT at 6.
It's really so powerful,
Yeah,
isn't it?
that was the word that I was going to say.
Yeah, so powerful they've lived it, they've seen it, they've literally been watching life and death. And I wondered as I was watching them, how does it feel for them? Because I think for so long, we said it introducing this story, these are the people that we trust for our health care, and yet over the last year and a half, so many people have questioned them, and you know, and we've entered politics into it. Did they talk about that at all?
Yeah, we explored that part of the conversation a lot at 6 too, and they also talked about more about the mental health aspect. I mean, you heard Bill Hawk, the registered nurse, talking about how he felt like his soul was being beat down, and all of them have really had to, as I think a lot of us on a smaller scale have had to reassess our mental health over the last year and a half. That's something that each one of them is having to do and figuring out how to navigate it in their own way.
Yeah, Jatera, did they talk at all about whether they're questioning their future in healthcare?
Yeah, so, you know, several of the doctors that I talked with say, you know, this they know is their calling, they know that they're needed. They're more concerned about the younger generation, the 20 and 25-year-olds who are in healthcare, who this is really their first experience going through something like this, and they're concerned that burnout is going to have a big impact on how many of them actually stay in the field.
Right, the burnout, the negativity, it's already such a stressful, demanding job, and then you add this layer on top of it. Well, excellent reporting as always. Thank you so much for joining us, and we're looking forward to your full report tonight at 6 o'clock.